Hi everyone, it's Dr. Marco. Welcome to this week's health tip. Well, for anybody who had an appointment yesterday in my office Wednesday, you'll know that it was a record-breaking day. And not because I saw so many people, it's because I actually didn't make it into the office. For the first time in my career, I actually had to call in, not because I was sick, but because I was injured. And I've been injured other times, but I was always able to kind of make it to the office and work even with an injury, but this time, no go. So I'm going to give you a little context. So it was a back injury. And maybe about 12 years ago or so, I hurt my back really bad for the first time. And I was in a gym. I was doing something, squats in a machine called the Smith machine, where there's like a pulley system. The bars are going inside these pulleys, and I had the weight on my back. And when I got up to the top, I kind of went like this, and the machine, by the pulley system, the weights continued up and came back down again, and I wasn't expecting that. And then it just jarred my lower back, and then I was just on the ground, couldn't move. You know, spasm, certain movements it would just kill like crazy. My back would spasm up and it would be really difficult to move. Luckily I was right beside a chiropractor at that point, so I went to see Dr. Gus and he worked on me a little bit. That time I would say it lasted maybe 4 or 5 days of being pretty bad, but you know, after about a day or two I was still able to functional. I could still get around with some pain and careful bending and stuff. So fast forward about, I don't know, a number of years, and then maybe about a year or two ago, I went to an indoor parkour thing with my son, and it was kind of like a family day at the parkour place, and so we were doing rolls and jumps off of high things onto mats and things like that. When I did it, I didn't notice anything, but the day after that, then my lower back started to hurt, and then it got really bad, and then that was one of the days where I was really bad, and I wasn't sure I was going to make it, but I was able to come to work and still work. And luckily, same thing, I was able to get to my network chiropractor, my other chiropractor, and I was able to kind of continue working. But this time, on Sunday, I was in my dad's house in Peterborough, and I was sleeping on a different bed than I usually sleep on, and I just felt off a bit in my lower back as soon as I woke up on Sunday. So Monday here in the office, I just felt off a little bit in my back, and I kept trying to open my hips. I felt like something was off in my sacroiliac joints. I knew it wasn't that balanced. But I still wanted to exercise, so I did my usual rebounding and did my surge training on the trampoline. And then I decided to do what's called box jumping, where you're just kind of doing like vertical jumps onto I was doing it onto a chair, basically. And on the third jump, kaboom! Really super intense, bad pain. I'll kind of show you where it happened. So this is the spine here, like this. So when I jumped up, this muscle here called the quadratus lumborum muscle, which attaches to your hip and some of your lower back muscles, I almost felt like that ripped a little bit, and then I got some really acute pain in my sacroiliac joint around here, and just a lot of this. So this muscle keeps spasming on me, because I think what I did is I kind of sheared my sacroiliac joint, either up or down, or I got it loosened, sprained the ligaments actually, and I strained the muscle. And so the sacroiliac joint, I think, is a little sloppy now. So anytime I make a movement where I start to load this hip, or if I turn on that side and that opens it up, this muscle spasms really quickly and I get like the really bad jabbing pain. And it was pretty acute, very intense at certain points. And almost to tears certain times when it was that bad. So it's very, very intense. And I always say the universe occasionally gives me an acute episode like this to make sure I can empathize with my patients who come in a bad situation like that too. So there's always a benefit to bad things like this. So what did I do to help myself? So today's Thursday. So Wednesday for sure I knew I wasn't able to get up and walk around. I said I knew I had to be home. So a couple of things. I don't take any medication, so I still didn't take any traditional medication, but I was taking arnica and things like that. And arnica doesn't really knock down a pain like this. It's not really, if you have like muscle soreness from working out, it might help a little bit, but this is like really acute, intense. But I'm still taking it anyway, so I was taking arnica regularly. And so for me, I always say, well, if I can still feel the discomfort and the pain, I'll kind of figure out which movements I can do that don't cause the problem. So in my bed, I said I can't roll to my right because I start opening that sacroiliac joint. So I found if I rolled to the other side and I kept my knees together, then I was able to do that. And sometimes I just found if I moved very quickly past that sticking point, then I was able to get past it, because if I just kind of go really slow, it just hurt, and the intensity would be really bad, so I just kind of made a quicker move just to try to get into the other position. And so, trying to breathe. Of course, I've mentioned it to you many times. Sometimes when your back hurts, you'll find something on the front of your body. So I was going along my front, my abdomen, pushing back towards where it hurts in my back, trying to breathe into those parts there. Obviously, I rested. And one of the first things I did, by the way, when I knew I heard it, I says, number one, I always know that it's going to be an injury and it's going to take some time. So already in my mind, I'm thinking, okay, here's a week and a half of not feeling good. But first thing I did was stop eating. So I just kind of started to just do some liquids, because when you have an injury, it takes a lot of energy and effort to kind of repair it. And when you eat food, it takes a lot of energy to digest your food. So just stopping eating, your body can take time and focus on what it needs to do, because as soon as you eat something that's a solid or some foods, your body has to direct all its energy and all its blood flow to the stomach to digest your food, because you don't want undigested food going through your system, so your body has to prioritize that so it can prioritize the healing. So I was just drinking lemon water. I got my wife to go get me some celery juice. So I had some lemon water and celery juice regularly throughout the day, just to try to keep it very light. And I had some tea, so I had tea with turmeric and cinnamon and a little bit of manuka honey. So I was trying to get some anti-inflammatory blood sugar regulation in with that one. And so I did that for 2 days, basically, just keeping it simple with water, basically. And then I had something called the Chi machine, which is a machine that has like a little oscillation like this, so you put your ankles in it and it actually oscillates your heels. So it makes a bit of a wave through your body, so that was keeping me moving. And I found that moving was a bit better than trying to stay still. I tried to rest as much as I could, obviously, but change positions when I could. But I needed to get up, and I was just walking back and forth through my house. Certain movements would cause a really bad jab, so I'd have to be careful how I turned, but I just tried to keep moving. So I kept hydrated, kept arnica on it. I was putting arnica gel on it as well on the spot. And, sleeping, I rested a little more, obviously. Tried to decrease food intake, went more for liquids, that kind of thing. So now that it's kind of getting a little better, I'm sort of upping my vitamin C, because for collagen, your body needs vitamin C for collagen. So I'm getting spirulina and other things for some amino acids to be able to construct the protein to kind of repair the area and that kind of thing. So now I'm sort of coming back into my high intensity shakes with wild blueberries and bananas and spirulina and chaga mushrooms and chlorella as well, barley grass juice powder for vitamins and minerals. Those are kind of my shakes, so I'm getting those in to kind of get the nutrition in there to help the healing. I have my network chiropractor coming to see me in 15 minutes. So I've had my network chiropractor see me, Jonathan, here in the office. He worked on me and helped a lot too. Trying to get as much hands-on as I can, but I just know it takes time. When you're hurt, you're hurt, and even if I do the magic adjustment, it's not going to magically go away in a day or anything. So I just know my mindset. I knew it's going to take some time to kind of recover and repair. And today I'm functional. I'm walking around the office. I had to decrease the number of people that I saw, but I was still able to work today. And this is like the 4th day after the injury. And I know typically if somebody had done the usual typical person, this probably would have lasted about 2 weeks of pretty intense pain. So I'm already 4 days in, and I'm starting to improve, and I know it'll keep getting better each day. So one of the keys is just kind of, if you can handle the pain, try to do it, because what happens is if I took a medication that would totally block my pain, if I move like this, I would hurt right here, and the body would say don't go past that. But if I took a medication, I wouldn't feel that discomfort, and I might go past that point and it continue to do a little bit more damage to the spot, because your body will kind of set up the pain to certain areas to say don't go past that point because you're damaging your tissues, so you'll feel the pain signal right away. So like I said, taking the arnica might have dampened that a little bit, but not very much. It's not like a medication for sure. So just doing that probably helped my body heal better, and it'll help it heal and repair even more completely as well. So if you can handle the pain, try to handle it. I never judge anybody's pain, and I was debating it in my head a couple of times too, but I was able to kind of go through it and push through, and I was able to survive, so here I am. So that's my health tip for this week. What did Dr. Marco do when he had a really super intense, bad low back episode? Because it can happen to anybody, so that's what I did. So hopefully that was helpful, and we'll see you next time. Bye everyone.